There are a few things you need to know when getting enrolled in Medicare. And trust me, just making sure you have the right information ready at the right time can make it a much smoother process. Hi, I'm Tricia Sandiego. In my work with AARP, I help navigate the complexities of Medicare. Let's take a look at 5 ways to help you enroll. If you haven't already, create a My Social Security account on ssa.gov. It's worth getting this set up for many reasons, one being that you can tackle this entire process online. Once you do that, the first step is to do your homework before you turn 65. I typically recommend starting the process about 6 months before your 65th birthday so you're not rushed and you have time to make decisions that are best for you. AARP has some decision guides linked in the description below. If you're still working, meet with your benefits manager to discuss your healthcare options. You may not need to sign up right away if your current health plan is better. Another step to take is to know your enrollment period. This is important because if you miss this, you could incur a penalty. Here's the easiest way to think about it. If you're not working, you have a 7-month enrollment window surrounding your 65th birthday that begins 3 months before your birthday month and ends 3 months after. So, for example, if your birthday is June 15th, your enrollment period is March 1st to September 30th. One thing to note here, if you're already receiving Social Security benefits, you're automatically enrolled in Medicare. If you're not, you'll have to take action to enroll. Next, decide whether or not to sign up for both Medicare Part A, that covers common expenses related to hospital stays, and Part B, that covers doctor visits and anything that doesn't require hospital care. Why wouldn't you sign up for both? It depends. If you or your spouse are still working and have health insurance through an employer, you may not need Part B, which requires a premium. Most people sign up for Part A because there is no premium, and it can act as a secondary insurance that might help pay for some things if you're hospitalized. It's time to choose between Original Medicare or Medicare Advantage. What's the difference? Think of Medicare Advantage as choosing the prix-fixe restaurant meal where the courses are already selected for you. Original Medicare is like going to the buffet, where you must decide for yourself what you want. If you do choose Original Medicare, this is when you may want to add on Part D, your prescription drug coverage, that has its own additional premium, as well as supplemental Medicare coverage. If you choose Medicare Advantage, which is private insurance that must meet government standards, you're getting the coverage of Original Medicare, Part D, and supplemental insurance called Medigap, all rolled into one. But you have limited provider choice. Medicare.gov has resources that can help you research the different plans, which is important because like other private insurance, they offer different features and benefits at different levels of cost. Another critical step is to decide if you need financial assistance. Medicare is not free. You'll have out-of-pocket expenses such as premiums and deductibles to consider. If you need financial assistance, you may be eligible for a Medicare savings program based on your income. We have great resources compiled on aarp.org, linked below. I hope this video will help simplify the process of signing up for Medicare and give you some useful tips on what you'll need to enroll. We have included links to more information on aarp.org in the description below. Please take a moment to subscribe to our YouTube channel so you don't miss out on future videos like this from AARP.